Okay. So in previous class, we have seen that how the signal will be generated, that the amount of carbon dioxide is becoming more and more oxygen will be needed and more consumption of oxygen will be needed. So chemosensitive center will sense it and ultimately the order will be generated from this medulla oblongata and the rate of respiration will be regulated. So here two important point has been written. So we will see one by one. The role of oxygen is insignificant in a regulation of respiratory rhythm. So I told you what is the meaning of respiratory rhythm. Respiratory rhythm means the the regulation of respiration, either the rate of respiration should be more or less. So when it is being said that the rate of respiration is becoming more or less or becoming normal one, then it will be decided by based on the partial pressure of carbon dioxide only, or we can say that carbon dioxide concentration is the only factor which regulates the respiratory rhythm. Means here you just see these chemosensitive center are just the recognizing or sensing the amount of carbon dioxide only. So here no role of oxygen is there while sensing that the amount of carbon dioxide is less or more, or amount of oxygen is less or more. So here the carbon dioxide is playing a key role, not oxygen. So this point is so much important, that oxygen is not playing a significant role in the sensing of this the amount of carbon dioxide or oxygen. And well, the more amount of oxygen will be needed only be decided by the amount of carbon dioxide only. So it has been written here. Now it has been written that when blood will trap the carbon dioxide, then the pH becomes low. Means the pH of blood becomes less, or we can say the blood becomes acidic when it transports carbon dioxide, and when the blood transports oxygen, or you just see when blood transports oxygen either in any form, then the pH of this blood changes to basic. So you just see when blood is trapping carbon dioxide or transporting carbon dioxide, then the pH of this blood becomes low and it will become the acidic one. And when the same blood is transporting oxygen, then the pH becomes high, or we can say the blood of the pH of the blood becomes more, and it will become alkaline or basic in nature. Now we'll see some diseases associated with the respiratory system. So first one is the asthma. First disease, here we will talk about the asthma. So this one is a chronic disease. It affects the bronchi and bronchioles of the lungs. So we have seen already the structure of bronchi and bronchiole. Okay, so these are the path through which we are inhaling the air, and ultimately air reaches to the alveoli. So these are the places through which the air moves. So it affects in this chronic disease asthma. The most affected part would be bronchi and bronchioles of the lungs. It causes difficulty in breathing. So if these will be affected, then the person feels difficulty in breathing. In severe condition, cough, restlessness, wheezing sound also comes. So these are the symptoms, and when we'll see the what is the cause of this asthma, then it may be caused by the cold air. Means in winter season you must have seen the persons the persons who are having the disease asthma will be affected more in cold season, in winter season. So cold air will enhance the asthma. And the second factor, airborne allergens. So sometimes the airborne allergens means some of the antigens will cause the allergy, due to which the bronchi and bronchioles of the lungs will be affected, and the person will feel difficulty in breathing. And there is respiratory infection. So certain infectious material, certain infectious agents are there which will affect the bronchi and bronchioles, or we can say the ultimately the lungs. After that the person will be affected by all these symptoms, and finally asthma will happen. The respiratory infections, the physical activity, some of the physical activities also cause asthma, and air pollutants. So air pollutants are playing a major role in asthma. The persons living in the air pollutant environment, will be more affected by this disease, asthma. Now, emphysema. So it is again a chronic disease, and chronic means long-term disease. Occurs due to damage of alveolar walls of the lungs, which results a reduction of respiratory surface. So you know that alveoli is the place where actually the exchange of essential and waste material takes place, exchange of gases takes place. So here, if alveolar walls will be affected, it means what will happen? The proper amount of exchange of gases will not happen. So here it occurs due to damage of alveolar wall. If alveolar wall will be affected, it means no proper exchange of gases will take place. And here it results the reduction of respiratory surface. So what happens? You know that due to the specific structure or the specific structure of this alveoli, we know that the surface area of this alveoli increases, and due to the increased surface area of this alveoli, a maximum amount of exchange of gases takes place. And if anything happens with the respiratory surface, or we can say the alveolar wall, then whatever respiratory surface should be there will not be there, and the proper amount of exchange of gases will not occur. So occurs due to damage of alveolar wall. So here in this disease, emphysema, the alveolar walls will be affected, and after that it will be resulted in the reduction of respiratory surface. The main symptom of the emphysema includes shortness of the breath and cough. So if obviously if the surface area of this alveoli decreases due to any of the disease, then what will happen? The exchange of gases will not be proper. So what will happen? The rate of respiration increases. So ultimately, it will be said the person is having shortness of the breath, and cough will occur. Emphysema might lead to the loss of elasticity of the lungs, and if the person is losing the elasticity in the lungs, so you know that the lungs expand and become relaxed, and due to this expansion or relaxation of the lungs, air fills in this lung, and from there our blood collects the air. So what will happen due to this loss of elasticity of the lungs? Whatever air the lungs has to inhale and to be exhaled will not be in proper amount. So shortness of the breath will occur. Factors causing emphysema. So certain causes are there which will promote this disease emphysema. So here cigarette smoking, dust, chemicals, air pollution, smoking tobacco, and exposure to passive cigarette smoking. So all these factors are mainly playing an important or key role in progression of this disease emphysema. Now we'll come on the next disease, occupational respiratory disorder. So this occupational respiratory disorder are defined as any of the disorder which affects the respiratory system by long-term inhalation of chemicals, proteins, and dust. So what happens if any of the foreign material, if any of the unwanted material we are inhaling with our inhaled air, then it will cause some defect in our respiratory system. And in general, it will be called as occupational respiratory disease. So this is a general term which we are using for any of the disorder which is affecting our respiratory system. It would be called by various reasons. So here, occupational respiratory disorder might happen due to inhalation of following substances. So since we are inhaling unwanted substances which will be harmful to our lungs, will cause ultimately this disease. So here, fumes of the metals, smoke from the burning organic materials, spray of varnish, paint, acid, and pesticides, dust from cotton, silica, coal, drug powders, and pesticides. So all these chemicals, along with the gases from the industries, for instance ammonia, chloride, and nitrogen oxides. Okay, so all these gases and fumes and smokes and all these chemicals will cause some defect in our respiratory system, and ultimately it will be called as this is a general term, occupational respiratory disorder. Okay.